Now I invite Dr. Laiana Azevedo Quagliato, Brazil, assessing the impact of blue and green space on mental health of children and adolescents. Thank you very much, Dr. Laiana. Dr. Laiana is Associate Professor of Child and Adolescent Psychiatry in UFRJ, Coordinator of Child and Adolescent Psychiatry Laboratory at UFRJ, permanent faculty member of the postgraduate program in psychiatry and mental health at the Institute of Psychiatry of Federal University of Rio de Janeiro. She's also a member of a Young Physician Leaders Program of National Academy of Medicine.
Thank you very much. Good afternoon. It's a pleasure to be here. I'd like to thank the organizing committee for inviting me to speak here. I would also like to thank to the president of the National Academy of Medicine, Professor Iriade Busquela, to all the academics that are present here today, and to everyone that made this important event possible. I will talk about one of the projects that I'm involved, one of the research projects that I'm involved, that is the impact of blue and green spaces on mental health of children and adolescents. I have no conflicts of interest, and evidence shows that there is a positive association between blue and green spaces and mental health in children and adolescents. In particular, blue and green spaces, the longer a child or an adolescent is spent in a blue or green area, the less likely this child or adolescent will present cognitive problems, social problems, depression, psychiatric disorders, and emotional problems. Also, children and adolescents that live near green or blue spaces are more likely to present autism spectrum disorders and attention deficit hyperactivity disorders. So overall, we can say that blue and green spaces might be protective factors for children and adolescents all over. However, in autism spectrum disorder children that present anxiety symptoms, to stay for a longer period of time in blue or green areas might increase their anxiety symptoms according to recent meta-analysis. We still don't know why that happened, and we also don't understand why blue or green spaces might be protective factors for several mental conditions in children and adolescents. One possibility is that green and blue spaces, they improve social coherence, they support psychological restoration, they decrease noise and air pollution that are related to mental disorders, they improve immune function, and they encourage children and adolescents to exercise. And exercise alone is a protective factor for mental conditions. In addition, green and blue spaces, they reduce stress levels in children and adolescents. And that's really important because high levels of stress and early life adversities, they are a risk factor for mental disorders later in life. And we still don't know exactly what are the causes, why the stress is related to mental disorders later in life. But we know that high levels of stress might have a role and might contribute to epigenetic changes in our central nervous system. In addition, high levels of stress might be related to the hyperactivation of microglia cells. Microglia cells are immune cells inside our central nervous system, and these cells are really important to us because they are related to synaptic pruning. That means that microglia cells are important to keep the synapses that our central nervous system needs, and they eliminated the synapses that our nervous system doesn't require at that point. And that's really important, and that happens to all of us here and to children along the neurodevelopment. However, high levels of stress and early life adversities might be a problem since they can hyperactivate microglia cells. And the hyperactivation of microglia cells are related to abnormal pruning and to the release of inflammatory cytokines and oxidative stress markers by these cells. And inflammatory cytokines and oxidative markers are neurotoxic to our central nervous system. So, although we don't know for sure why early life adversities and high levels of stress are related to mental disorders later in life, we know that epigenetic alterations and the hyperactivation of microglia cells might contribute to this connection. And that's really important because early life adversities is something really prevalent all over the world. More than half of all children and adolescents will have at least one kind of an early life adversities by adulthood. And early life adversities are related to several mental health problems, including mood disorder, anxiety disorders, and substance use disorders. And psychiatry problems related to early life adversities are also more severe, persistent, and resistant to treatment than disorders that are not connected to an early life adversities. So the question is, why do some children develop a mental health disorder after an early life adversities while others do not? While someone that experienced exactly the same early life adversity than another person at exactly the same age will not develop anything in the future, while others will. To answer that, we need to understand and to identify who gets sick in specific circumstances. So we need to focus on conditions that predispose to pathology. We need to identify who does not become sick in comparable circumstances. So we need to focus our attention on protective factors. And we need to understand why one group is different from another group. So we need to turn our attention to the mechanisms that favor one outcome instead of another. And that's exactly what we're trying to do in this research project. This research project involves research from Brazil, from France, USA, and Spain. And we are building an internationally representative cohort of children that are followed from birth to adulthood. And we are using a multidisciplinary approach of social science, health science, and environmental science. So far, we have a database of over 24,000 of children and their parents, and these children and their parents were followed for 10 years. And one of the goals of this project is to identify why some children will develop a mental disorder in the future, while others will not develop anything. And since we know that green and blue spaces might be protective factors for at least some mental conditions, we are asking how green and blue spaces might be related to the development of resilience mechanisms that can prevent children from developing a mental disorder. In order to do that, we are building predictive models to better understand the trajectories of neurodevelopment in children and adolescents. To date, we did a small analysis, a subgroup analysis, using data from immigrant children. These results are not published yet, but we verified if immigrant children that are individuals that present higher levels of stress comparing to non-immigrant children, when exposed for a longer period of time in a blue or in a green area, we would like to see if they could present less anxiety or depressive symptoms than immigrant children that didn't spend any time in blue or green areas. And we noticed that green and blue areas, they might protect immigrant children, and the longer a child, yes. Perfeito. So, yep, here. So we noticed that the longer a children or an adolescent spend in a green area, the less likely he or she will present anxiety or depressive symptoms, and the same is true for blue areas. So at least in immigrant children, we can say that blue and green areas are important and might be protective factors for anxiety and depressive symptoms. And this is important since urban planning and policy will benefit from more information on the likely generality of effects on psychiatry disorders and how those effects are realized over the life course. So it's relevant to map the health implications that environmental exposures may entail for the general population, understand their explanatory mechanisms, and tailor effective intervention. As our grandmothers used to say, nature is a good medicine, and now science can explain why. Thank you very much.
Thank you, Dr. Laiana, for the very nice presentation.